Well, yeah, but this patient is going to be much happier, much better off, and the family is going to be much better off because they didn't have to keep doing this. All right. Okay, so what we're going to do now is I'm going to turn it over to Janet, and I'll hand over my mic here too. But so Janet Brush, she's an LCSW, MSW, MSG, and ABCDEFG. She has a Master's of Social Work and a Master's of Science in Gerontology and is a licensed clinical social worker in California. She has a lot of experience in gerontology, including working with a variety of issues such as dementia, depression, caregiving, and other issues and associated with the aging process. And she's the owner of Senior Alternatives Care Management in Oakland, with also providers here in Walnut Creek, Lafayette, Concord area as well, or basically all of Contra Costa County. So, Janet?
Today I'm going to talk about one of my favorite professional subjects. Why is it my favorite subject when it's not a really, obviously not a very pleasant subject, is because it works. I think it's very obvious to people why, but I'm going to show you some ways in which we've taken some of this information and put it into protocols and have been able to use it with our families, with our clients with dementia, with agitative dementia. We've also applied this with depression as well as with symptoms of mental illness, and it's been very effective. So it's going to play a little bit off of what Eric was discussing, but what Dr. Freitag was discussing, but it'll also kind of put it more into a form that you can take it home and actually use it. Okay. So I'm going to talk a little bit about a study that I was in at NYU, Aging and Dementia Research Center. Then I'm going to talk a little bit about some of the research backing this information, some facts and theory on dementia and related behaviors. I'm going to go through that very fast because Dr. Freitag did a really great job of doing that. How to avert a catastrophic event, the protocols, and then we can go into a very quick case study. So I'm going to just read this because I thought this was a really great study and it summarized how successful these kinds of interventions can be. Linda Girdner, RN, and her colleagues developed an intervention to decrease behavioral disturbance and increase pleasant events for individuals with dementia based on the theory of progressively lowered stress threshold. PLST is based on the premise that as dementia progresses, the affected individual's ability to adapt to environmental and interpersonal stressors decreases. This approach teaches family caregivers problem-solving strategies to identify and provide activities that are appropriate for the individual's current level of functioning and to implement environmental modifications that support activities of daily living functioning. Activities of daily living are classified as events such as eating, even interacting socially, toileting, so things that we do on a daily basis. The results were, as we could all predict. In a randomized controlled trial of this approach, 237 caregiver/care recipient dyads from 8 research sites were randomly assigned to the PLST program, or a usual care control group, which was 105. At the 12-month assessment, in comparison with the control group, the PLST group had significantly lower caregiver distress over behavior problems, and for non-spouses, the frequency of behavior problems was also significantly lowered. The reason I wanted to read this is because it's important to know that there's a lot of research out there that confirms this kind of protocol, and it's working beautifully. I was lucky enough to be employed at NYU Aging and Dementia Research Center when this kind of study was going on, and I was one of the clinical interventionists. I worked alongside some very reputable psychiatrists and psychologists and neurologists, and we were in a study. I think our group was actually part of one of those studies that was reported on, I'm pretty sure. But there's actually a very large group throughout the United States that was doing it at the same time, and all of us came away with the same results. Families that were able to manage these behaviors, that were able to decrease their caregiver stress, decreasing the chances of institutionalization, Also, decreasing the use of psychotropic medications, such as Seroquel, Risperdal. So again, research is there. We do it every day in our care management, and that's why it's my favorite subject, because we can go in and give families some strategies, and I'm going to go over those quickly. And it works beautifully. It's very rare. I mean, I can probably think of maybe 2 cases where it hasn't worked effectively. So I'm not going to spend a lot of time on this, but obviously dementia we define. We've already gone over that. Reasons why behaviors may change. So as we all know, dementia is actually an organic brain syndrome most of the time. That's either from medication or from something such as Alzheimer's. So it's important to know that it's actually happening. The environment, incoming stimulation, that's probably one of the biggest reasons why we see behavior changes, what's going on in the environment. And health, which Dr. Freitag discussed, must be ruled out first. The minute we have a client that has a sudden change in their level of agitation or in behavior, we call the doctor. And of course, medications cause agitative reactions all the time. So these are very important things to take a look at. This is something that if you have a loved one with dementia, that should become a mantra. People with dementia most likely will not have the ability to change their behavior. We all know that. But if we change what is going on in their direct environment, modifying the stimulation in the environment can then result in a change of behavior. And always remember that behavior is not deliberate. So, and please, this lecture is not meant to make anybody feel guilty. Because as we all know, especially if you're a spouse, but even professional caregivers, you cannot be expected to believe this all the time and to act accordingly. So please, I mean, we're the first ones to tell our families, just don't pick up the call the 7th time mom calls you. Just don't pick up the phone. So what are some suggestions for coping with changed behaviors? A calm, unstressed environment in which the person with dementia follows a familiar routine. Having the same schedule on a daily basis is extremely important. We were talking earlier about one of our clients who has a change in caregiver on the weekend, and it seems to be that's when the agitative behaviors are occurring. It's not that the caregiver is not good, it's not familiar. And especially when you're losing your ability to process and things are changing around you, it can be very distressing. Try to keep the environment familiar. People with dementia can become upset, okay, if they find themselves in a strange situation or among a group of unfamiliar people. If behavior becomes difficult, do not attempt any form of physical contact, such as restraining the person. A lot of this is very basic, and I'm going to go through it quickly so we can actually get to how we apply protocols. Leading them away or approaching them from behind. There's nothing wrong with leaving a person with dementia just alone, just walking out of the room as long as they're safe and letting them have some time to quiet down. And of course, another mantra, don't take changed behavior personally, which is, again, it's very hard as a family caregiver to do. Suggestions for coping with changed behaviors include try not to raise your voice, speak slowly in a calm and reassuring voice. Avoid punishment. The person may not remember the event and is therefore not able to learn from it. And I guess that learning,
I was going to say the challenge is not raising your voice when you've done it, but said it for the 8th time. It's hard to not get a little louder each time.
Exactly, and that's why earlier I said this is all really great theory and it should be your mantra, but you're not going to be able to do it all.
That's your goal.
Yeah, exactly. I mean, and we recognize that a lot of our job as geriatric social workers is we call it our psychoeducation component, and that's for the family, whether it's an adult child or a spouse, to really help them to kind of process through what they're going through and not to feel guilty about this stuff, how to cope with it better,